Frozen shoulder is the name that we give to a condition of restricted movements with very intense pain. We don't know what causes frozen shoulder. It is a disease that appears slowly and usually affects people between 40 and 65 years of age. It affects more women than men, and it's more common in people with inflammatory arthritis, osteoarthritis, trauma to the shoulder, prolonged periods of shoulder immobilization, and rotator cuff disease. But frozen shoulder may also occur with conditions that are not related to the shoulder, like diabetes, thyroid problems, brain injury, angina, heart attack, and even liver and gallbladder diseases. Today, I'll show some exercises that people can do at home when they have frozen shoulder to improve the mobility of the shoulder and also to have a faster rehabilitation period. So let's talk about frozen shoulder today. First, I think it is important that you learn what frozen shoulder is and understand that there is no miraculous treatment to solve the problem in a few days. Even with the best treatment, it may still take months or years for frozen shoulder to solve completely. The shoulder is a very dynamic joint in the form of ball and socket. To maintain the ball inside of the socket, there is a capsule around the shoulder that keeps the synovial fluid inside to lubricate the bones and cartilage. Frozen shoulder is also called adhesive capsulitis because there are dense adhesions, capsular thickening, and capsular restrictions. It is a disease of the capsule, not the bones, the tendons, or the muscles. When we look at the microscope to study what is going on in the capsule, we see that there are fibroblastic proliferation and no evidence of inflammation. This is similar to what happens in Dupuytren's disease, a type of thickening of the palm of the hand that is commonly seen in patients with diabetes and thyroid diseases. Patients with diabetes, when they develop frozen shoulder, it is a more severe type of frozen shoulder, with more pain, more restriction, and longer time to recover. There are researchers looking into the causes of frozen shoulder, and they have suggested genetic factors, environmental conditions, and even bacterial infection. Frozen shoulder happens in 3 stages, and each stage lasts about 6 months. The freezing stage is the first one. It's the most intense pain, even at rest. The pain is much worse at night, and the patients can't find a comfortable position to sleep. The movements start getting limited. The first one to lose is external rotation. The shoulder has basically 6 movements: internal rotation, external rotation, abduction, adduction, flexion, and extension. At the end of the freezing phase, basically all movements are limited. The duration of this stage varies between 3 and 9 months. It is important to see a doctor for a proper diagnosis, mainly to exclude other causes of pain like a septic arthritis, a tumor, or even shoulder dislocation. Second is the frozen stage. Here, the pain is getting better. There is pain only with movements, and there are still a lot of restriction of movements. Because the muscles are not being used, we see a lot of muscle wasting, atrophy, including the deltoid, the biceps, and triceps muscles. And this stage may last up to 12 months. The last stage is the thawing phase, where the pain is minimal and the capsule starts getting flexibility and movement is restored. This may last up to 12 months. Unfortunately, some patients will never regain normal range of motion again. They will have some residual restriction. Before I continue, let me remind you that this video is not intended to replace medical advice. It is for educational purposes only. If you need medical advice, contact your doctor, and in case of emergency, go to the nearest emergency department or call 911. The treatment of frozen shoulder involves strategies to reduce pain and improve range of motion. For pain management, we use oral, non-steroidal anti-inflammatory drugs like ibuprofen or naproxen. I have another video that I explain these medications, the doses, the indications, and side effects of the most commonly prescribed anti-inflammatories. We also use intra-articular steroid injections to reduce pain. We may also recommend the person to apply heat, like a heating pad or hot packs. And when they go to physiotherapy, they can also receive modalities like ultrasound, electrotherapy to reduce the pain around the joint, acupuncture, mobilizations. The exercises are mainly to maintain the range of motion and avoid more limitations. But it's important that the exercises do not cause more pain. The exercises in frozen shoulder need to be individualized and determined by the stage of the disease, stage 1, 2, or 3. I highly recommend that you talk to your physiotherapist because frozen shoulder is very debilitating and the exercises need to be individualized. Also, the physiotherapist will be able to do some mobilizations of the shoulder that you cannot do by yourself at home. So you need their help. The guidelines from the American Physical Therapy Association suggests that intra-articular corticosteroid injections combined with shoulder mobility and stretching exercises are more effective in providing relief and improving function than compared to the shoulder mobility and stretching exercises alone. So orthopedic surgeons, rheumatologists, physiatrists may offer other treatments like manipulation under anesthesia, capsular release under arthroscopy. In the pain clinic where I work, our team is also performing shoulder injections called hydrodilatation or hydrodistension, which is basically injecting a large amount of liquid, usually between 10 and 90 millimeters, containing local anesthetics, corticosteroid, and saline. They usually inject the liquid under ultrasound imaging or fluoroscopy until the capsule distends and breaks up the adhesions. Usually not more than 40 millimeters is necessary to achieve this. This hydrodistension must be repeated a few times. Well, if you want to read the script of this video, there is a link in the description of this video below, and you can download and you read the script of this video. Now, I will demonstrate some exercise that can be done at home without supervision. These are the most common exercises that I recommend for patients with frozen shoulder. But if they aggravate the pain, the person should stop and talk to their doctor or physiotherapist. The exercises are the pendulum, the fingers on the wall angel, rotation on the wall, internal rotation, external rotation, shoulder circumference, cross stretch, strengthening flexors, abductors, and external rotators, and with an elastic band, internal and external rotators. So this is exercise number 1, or pendulum exercise. So the pendulum exercise, basically you need a desk that is about the height of your hip around here. And what you're going to do is you're going to lean on the desk or table, and you're going to let your shoulder very soft here. And what you're going to do is you're not going to move the shoulder. The arm is just going to hang there. What you're going to start doing is you're going to start moving your legs, so then to create a pendulum for your shoulder. And then the shoulder capsule starts relaxing and removing any adhesion, removing any stiffness of the shoulder. You see I'm moving my hips, and you can do this back and forth, and if possible also do some movements, circular movements, opening circle and closing inwards and outwards, and you do this for about 1 minute. And sometimes we recommend the person to hold on some sort of weight just to pull the capsule of the shoulder a little bit more. So then if you have a water bottle, you could be doing the pendulum with a water bottle. Just relax the shoulder and move your knees, bend the knees back and forth, and relax. The most important thing is to relax the shoulder. Okay? So this is exercise number 1. The exercise number 2 is fingers on the wall. So let's do this. You start walking on the wall here, and you go up, and sometimes just getting here is very painful. So if that's the case, stop and then go down. But if you can go up, if you can go higher, let's say that you can get here, what you can do is, if you can write on the wall, I'm not going to write a pencil mark on my wall, but if you can do a pencil mark there and see when you start this exercise, what was your maximum range of motion for abduction? And so here it is. Try not to bend your body. So your body should be straight, and then you just go up, and then the more you do, you'll be gaining more range of motion. Always remember to relax the shoulder, don't get tense, your body straight, and go up, all the way up. And if you can reach all the way up, that's excellent. It means that your range of motions for abduction is practically normal. And then you can go down. Okay, just go until you start having your pain, and then go down. And you can repeat this 8 repetitions. Go to as far as you can, and you can rest. You can, if you're getting tired, you can rest your hand here and then keep going. The exercise number 3 is the wall angel. And what you have to do is find a wall behind you, touch your hips, the shoulders, the shoulder blades, and your neck, and your head on the wall. So when you're touching this, what you're going to start doing, raising your hands, and keep your palms down, and try to touch the wall and go all the way up. Again, this is similar to the fingers on the wall. We're trying to improve range of motion for abduction, and sometimes it's hard, and sometimes one shoulder you can go here, the other one you can go here, and then you start having pain. If that's your case, just do that, and then lower, and try to improve your range of motion slowly, slowly. And you can measure this. If you're improving, you will see that each day you'll be able to go higher and higher, and this would be normal. So this is the wall angel, and you can do this 8 times. Wall angel, and lower. Try to touch the wall when you do this, and keep your hips, shoulder blades, and head touching the wall behind you. The exercise number 4 is to gain range of motion for internal rotation and external rotation. So again, in the same position on the wall, your hips, shoulder blades, and head are touching the wall. What you're going to do is internal rotation, and you do both shoulders, and you should be able to touch your belly. So to do this, your elbows are touching your body here. Touch your chest, don't open your elbows, keep them here. Bend the elbows at 90 degrees and just go in. This is internal rotation. And this is neutral position. And now this is external rotation. So you see, a normal external rotation, you are not supposed to touch the wall. It's about here. This is normal external rotation, and internal rotation normal is touching your belly and about 70 degrees here, internal and external. When a person has frozen shoulder, this is one of the first movements that they lose. They are unable to do external rotation. And this means that the shoulder is starting to get frozen. Internal rotation, external rotation. And remember to keep the elbows close to your chest. And the exercise number 5 is shoulder circumference, which is another range of motion exercise. We're just going to do these movements. So forward, circumferences forward and backwards. So backwards, you can do 8, backwards, 5, 6, 7, 8, and now 8 forward. 1, 2, 3, 4, 5, 6, 7, 8. And then what you can do when you finish is try to squish your shoulders against the wall. So try to touch the shoulders, the back of your shoulders on the wall, and squish, squish, squish. So then you're contracting the rhomboids and getting the shoulder blades close to each other. So do this and squish and relax. Excellent. The other exercise is the cross chest stretch. You're going to go across your chest, and with one hand you're going to stretch. You're stretching the posterior capsule of the shoulder, which is usually very painful, especially if the person is starting to develop frozen shoulder. If this is too painful to you, you should be doing this exercise with a physiotherapist. But if you can tolerate this, just stretch, pull the back of your shoulder here, and do the same thing for the other one. So bring all the way down here, all the way across the other shoulder, and then you pull and try to relax when you do this. Don't get too tense. Relax, relax, and feel the fibers on the back of your shoulder stretching. This is the cross chest stretch. Strengthening of the shoulder against the wall. So what you're going to do is, with your elbow straight, you're going to put your hand here and you're going to press the wall. Just be careful if you have drywall, and if you are too heavy, you're not going to punch a hole in the drywall. So here, press against the wall, press, 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 press. So you should be feeling that you are strengthening these muscles here of the anterior side of your shoulder. And you can do with the other one, press, 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 press. So you're strengthening the flexors of the shoulder, which are the anterior, the front of the shoulder. You can also do on the side, so press against the side, and remember your elbow should be straight. So press, 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 press. And the same here, press against the wall. This is isometric exercise. Should not hurt when you do this. Now the other one that is important is, now you bend your elbow, touch the elbow and your hand here, because we're going to do here, first is you press the elbow against the wall, press, 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 press. And now you're going to press the hand. So now don't touch the elbow on the wall, and press just the hinge. So this is strengthening for the external rotators. So press the elbow, and now press the hinge. And do the same thing for the other side. Bend the elbow, press the elbow, and now press the hinge. Press the elbow, and now press the hinge. So this exercise with an elastic band, you can buy these elastic bands and attach them to a doorknob or the legs of a table. And they come in different strengths. This one is very light, so it's easy to move, but there are others that are very hard. And you can order those. I will put a link under the video description below if you want to order these elastic bands. So here are some exercises that we usually recommend for people because they have restrictions in external rotation, so they usually cannot do this. So if they try to move a little bit, and they can do, this is doing internal rotation, this is doing external rotation, and here this is doing external rotation and this is internal rotation. So this is the kind of exercise that the person can do to maintain the strength of the muscles that do these exercises. Okay, so this is one thing that they can do. They can also be doing exercises like row exercises with elastic bands like this. This is good for the posterior part of the capsule, stretching the front of the shoulder. And they can also do this reverting here in the front, like starting from here, and they can be stretching the capsules on the back. So there are a lot of exercises that you can do with elastic bands at home, and of course if they hurt, stop doing them and talk to the physiotherapist. Well, if you like this video, press the thumbs up button here. Don't forget to subscribe to this channel and turn on the notifications so you can be alerted when I post new videos. And watch my next video here. Thank you for watching. Goodbye.